Hi. Today I'm going to be talking about bipolar disorder. Bipolar disorder is previously known as manic depression. It is a mental health disorder that causes periods of depression and periods of abnormally elevated mood. Some of the symptoms for bipolar disorder would be um, uncharacteristic periods of anger and aggression. It would be a grandiose and overconfidence. It could be highly intensified emotions. Um, and sleep is also affected with bipolar disorder. There could be a need for very little sleep with still elevated energy and uncharacteristic impulsive behaviors associated with the energetic manic period. Moodiness is one of the symptoms. People may be confused or irritated. Uh, Things that can people can do to help themselves is to become educated regarding bipolar disorder. So they're equipped with coping mechanisms and different strategies which may alleviate some of the intensity of the symptoms. And this can include holistic approaches to treatment, which could be what a person is eating and exercising. A balanced diet can certainly help a person who is trying to take a more holistic approach at treatment. Mindfulness meditation and yoga. Um, as I said, balanced nutrition and a regular exercise, and different types of therapy, creative therapy. What's very important is establishing a strong support system. This may very well include a strong spiritual, faith-based support system. And another good holistic treatment would be acupuncture and massage. Um, One of the most important holistic forms of treatment would be family support. That seems to be a very good holistic treatment, which can ensure understanding, which the person who is enduring the bipolar disorder can feel more understood by their family if family is educated regarding bipolar disorder, and if they have strong, positive family support. Um, and having a strong family support also can help to improve communication, so that each person within the family, can understand one another. And it would be very important to learn problem-solving techniques, to be uh, well equipped when the individual reaches their energetic manic state or their depressive state, to have different coping mechanisms already set into place. For instance, having a counselor or a dear friend or someone who the individual can speak with on speed dial, and going to actually one of the best methods of treatment is also um, therapy, counseling. Counseling can certainly help with establishing coping mechanisms. Um, so a little bit more about bipolar. It is often characterized by elevated or extreme moods that may go back and forth between emotional highs and lows, and with increased energy and activity levels lasting at least a week, and sometimes months. An individual may have feelings of being very strong and powerful during their energetic energetic period and feeling like nothing can hurt them. They may have racing thoughts or impulsive thoughts and behaviors. Um, and bipolar disorder is a reoccurrent disorder, and it affects about 1% of the population. It is more commonly diagnosed in older teens and young adults. On average, the onset is about 25 years old. Um, Bipolar disorder often causes high risk of suicide or suicidal ideation. It also can cause high risk of severe comorbidities, cognitive deficits, and other disabilities. Um, Bipolar disorder can severely and can significantly impact family dynamics. And it often puts distress or emotional distress or strain on relationships. Especially the caregivers of the person who has bipolar disorder. Um, During acute mood episodes, the family may feel a bit of pressure because they are experiencing their loved one who is enduring these high and low um, energetic periods or depressive periods, and it can take a high strain when you see a loved one, suffering through depression, in extreme depression. Family members may experience anxiety, they may experience grief, or even it could be a financial impact due to the manic or energetic period that can lead to overspending. Um, some of the symptoms also for bipolar disorder, which are not, talked about often, is muscle tension and pain, um, weight fluctuations, chronic fatigue due to lack of rest, shortness of breath, sleep disturbance, and nausea and vomiting. Um, as I said, people who have other mental health issues are more likely to develop bipolar disorder. And this often includes conditions such as depression or anxiety disorder. Um, some of the good, some of the more common and effective treatments, non-holistic treatments for bipolar disorder, is adjunctive psychosocial treatment. And part of that would be considered cognitive behavioral therapy, interpersonal psychotherapy, interpersonal and social rhythm therapy, family-focused therapy, group psychoeducation, especially for bipolar disorder, social skills training, individual and family psychoeducation. Um, and the measurement-based care would include routine system assessments, data review and interpretations, and shared decision making treatment adjustments. And that is when the assessments are the counselor, the professional, and the client can come together and take a look at the treatment and see how it's going and make any adjustments that are needed in order to facilitate more growth. Um, Interestingly, bipolar disorder, as I mentioned, was initially referred to as manic depressive illness and insanity. That was actually how it was referred to at first. It's about 70 years later, it was termed bipolar. And the disorder was viewed in modern psychiatry as a mood disorder, which typically occurred in cycles, often marked by episodes of mania and hypomania, and depression. According to the DSM-5, it's categorized, the severity is categorized by bipolar disorder type 1, bipolar disorder type 2, and cyclothymia. cyclothymia. Cyclothymia being the least intense form of bipolar disorder. That is a chronic mild form of bipolar disorder, which is characterized by persistent and frequent mood swings between hypomania and mild depression. Symptoms are not as severe as bipolar 1 or disorder or bipolar 2 disorder. And full mania, and it doesn't quite reach full mania or major depression. And it is treatable with therapy and medication. And actually, many people often do not get treated for this cyclothymia. Bipolar type 1 is the most severe form of bipolar, and it's characterized by major depressive and full manic episodes. Bipolar type 2 is the lesser severe, and it's characterized by less intensified elevated moods, called hypomania, manic episodes or hypomania. Hypomanic episodes or hypomania. Um, and the as I mentioned, there are these 3 or 4 classifications. There is also one more classification called bipolar disorder unspecified. That's when the bipolar doesn't meet the criteria for any of the other types, but still has periods of abnormally elevated moods. And for bipolar 1, the mood disruptions and increased energy episodes will likely include 3 of these symptoms: inflated self-esteem or grandiosity, decreased need for sleep, more talkative than usual, more energy than usual, flight or ideas of subjective experience, and racing thoughts, and severe depression, or isolation, easily drawn to unimportant or irrelevant stimuli. And so it's these episodes lasting at least 1 week to several months, and they're very high highs and very low lows. So that is bipolar disorder in a nutshell. Thank you, Doctor, for a wonderful class and for being one of the most gracious and caring professors I have had thus far at Grand Canyon University. God bless you, and thank you for everything you've taught me. I am eternally grateful. Thank you.